Going over microanatomy of bone tissue, here we have compact bone versus spongy bone. Within the spongy bone, which has a trabecular pattern, and you know that spongy bone is also called cancellous bone, you can see red bone marrow where blood cells are produced. So we're talking about erythrocytes, leukocytes, platelets, which are derived from thrombocytes. And we know that red bone marrow is made up of reticular connective tissue. In looking at this model, we can see the osteons or Haversian systems with their parallel central canals. We can also see perpendicular Volkmann's canals or perforating canals. And we can also see osteocytes in this tissue which reside in lacunae. Here we have our concentric lamellae, our interstitial lamellae, and out here we have our circumferential lamellae. We have our periosteum with an inner osteogenic layer, remembering that the periosteum is dense irregular connective tissue, and that connects to the circumferential layer of compact bone or cortical bone by means of these fibers, which are called perforating fibers or Sharpie's fibers. If you're going to write Sharpie's fibers, don't forget that it has an E in front of the Y. So that is our microanatomy of bone tissue for skeletal bone. In viewing the axial skeleton, we have our spine, which is made up of vertebrae, and attached to this particular model we have the hyoid bone right here. And remember that the hyoid bone does not articulate or form a joint with any other bones in the body. It's actually just wired onto the skeleton so that it doesn't fall off and get lost. We know the axial skeleton includes the skull, which I'll go over in a separate video, all of the vertebrae, the hyoid bone, the sternum and the ribs, the sacrum, and then the coccyx, which is way down here. I'll go over those as well. So starting with the rib cage, the sternum is comprised of three parts. The upper portion of the sternum is called the manubrium, the central portion is called the body, and then the bottom portion, the inferior portion, is what we call the xiphoid process. We have 12 pairs of ribs. The first 7 ribs are designated as true ribs because each has its own costal cartilage. Costal means pertaining to the ribs. Ribs 8 through 12 do not have their own costal cartilage. Actually, ribs 7, 8, 9, and ribs 8, 9, 10 have cartilage that blends together. So ribs 8 through 12 are designated as false ribs, but in addition to that, rib 11 and rib 12 have no cartilage whatsoever, so they are also designated as floating ribs. So we have ribs 1 through 7 are true, ribs 8 through 12 are false, 11 and 12 additionally are floating. If we look at this little model right here, you can see the line between the manubrium and the body of the sternum, as well as between the body and the xiphoid process. At the superior aspect of the sternum, and more specifically of the manubrium, you have your jugular notch. So I'm going to go ahead and stop this video and talk about the vertebrae next.